what's left out there anymore.
No, nothing beats authenticity.
No.
Ever.
No.
It's a rare commodity now.
Isn't that sad, though?
Very.
Because I don't really get why. Social media ruined it.
Social media definitely ruined it. Social media ruined, I would say social media especially for me, social media ruined relationships. Social media ruined the feeling of hard work because everybody's winning. No one is
Also,
losing on social media.
Doesn't matter what profession you're in, if you look good doing it and you're not even certified, not licensed, anything, but as long as you could look like you play the part, then you can title yourself as whatever you want.
Yep, and here's the followers. And oh my God.
And it's crazy.
And then am I going to go to this person that has 1 million followers or this person that has 1,000?
Right.
It's like, oh my God, well, the person that has 1 million.
I'm terrible because people probably think I'm out of business. I don't post anything. I am the worst with business social media, but like not to pat myself on the back, but like my practice is great. It's thriving every day, But I don't need to be posting about it every single day. It's crazy.
Well, that's why there's the other side of it, and the side of it where you have people that just export that side of the business, and they go, here's a social media manager, here's somebody that takes care of all my accounts, takes care of my interactions, because it is literally a job.
Yeah.
If I didn't have to use social media to get more business and to network myself and to show people what I do, I have far too much shit to do on a daily basis.
I understand. You need social media.
Well, yeah.
Because no one would understand what you're actually doing. Do you know what I'm trying to say? At least with my practice, it's all word of mouth. I haven't advertised one thing
Me either.
since I opened.
Not a single dollar in ad revenue.
And I don't have any more time. I work Monday through Saturday.
I was going to say, what's a normal day for you like?
Monday through Saturday, I will work usually 8 or 9 a.m. to about...
No, you're good. You're good. I just like to I like to have it dead on.
Yeah.
But you're good.
Perfect. To about 3. Then I have usually an hour break, and then I'm back at it until 8 p.m. So literally, it's 8 a.m. to 8 p.m.
Yeah. And then what do you want to do when you're done? Do you want to start reposting everything that you've done all day?
Absolutely not. I'm lucky if I get a workout in, and then I want to go to bed.
Just right to bed, and it resumes the next morning.
Next day, yeah.
It's the social media is an interesting thing, and like you said, it's ruined a lot of things. For me, like I mentioned right at the start, the hardest thing for me is the loss of. Everyone just needs to be everyone needs to be noticed.
Yeah.
Everyone feels like I have a voice. Please notice me. And why does that? It's like.
And it's instant gratification because if you feel like you got enough likes, then you did your job.
Yep.
And it's no. I will never forget when I opened the gym, I didn't have enough money to pay for trainers at the time because I put all the money into opening the gym. I trained and taught every single class, and I was in clinical shifts at school. So it was when I tell you I looked sick, stress level, sometimes you look back and you're like, I don't even know how I did that.
Yeah, that's me with the competing. I don't even know how I did that during college and grinding away and doing everything like that. It's just, it's another level. And like you said, you look back and you just go, how did I get through all of that?
Yeah.
Because the workload is just so substantial and it really drains you.
Yeah.
But you have that mentality in the back of your head, no, you got to keep going. Got to keep going. Please keep going.
Eventually, it will come together, and you'll look back and be like, all right, this was all worth it.
It started to seem like it's coming together.
I can finally say it was all worth it.
I was going to say, it's starting to seem like it's coming together now.
I am loving where I am right now, which is a good thing. Well, I mean, I'm not where I want to be, obviously. You never want to be.
Never are.
And if you are comfortable with where you are, not a good sign.
Yeah.
You never want to be comfortable.
No, well, complacency is the killer of everything.
But I will say social media helped me tremendously with my surgery.
And we're going to get into that. We're going to get into that. So for those that don't know, I have the lovely Marina on. And we were introduced to do some videos together for your business.
Yes.
And that's kind of where we started off.
And I need you again soon.
Yes, which I'll come. I'll have Kenji hold the boom mic. It'll be great. It'll be perfect.
Oh, he's sleeping.
He's the podcast dog. That's it.
A few too many drinks.
He gets super excited to see the guest. And then he just goes, all right.
He's done.
We're good. And maybe
easy date.
Exactly.
Wow.
Mid-cast, he'll get up, he'll say hi again, and he'll go lay down again.
Perfect.
But you've had quite the journey medically and with your profession as well.
Yes.
So I kind of put a post out today just saying who you were, a little brief synopsis of you coming on the show, what we're going to talk about.
Yeah.
And I think it's important to kind of brief everybody on where you started. That's kind of what we start with every podcast when we have somebody new come in. How did you get into what you're doing? And I know you've always loved fitness. I mean, from the time that I've been following you, even before then, I kind of knew who you were through the grapevine of everybody going to see you. Always had a great physique, always busting your ass, doing your thing.
Try.
Seriously. But a business owner that still makes time, because I mean, how many people, so for me, when I was shooting constantly and I had to shoot every single day before I started weeding clients out, I would just, every project, yes, I'll take it.
You have to.
No gym though. The thought of going to the gym was non-existent because I was in a gym all day shooting. So for somebody that's a personal trainer or giving classes and training people, plus the medical side of things, plus being a business owner, it's a lot.
It's been a lot. And like I said, I look back and sometimes I'm like, wow, I cannot believe how far I've come. And it's a good feeling.
It's a really good
I had
feeling.
a lot of mental breakdowns, don't get me wrong, and I still do.
Let's go, me and you.
100%. Let's talk about mental health.
Oh my God, just breaking down every other day. If Monday I'm on top of the world. I'm gonna kill this week.
Now
by
it's like,
Wednesday, you're just
now I'm dealing with like patience, and I'm definitely like a very empathetic person, so I take home everyone else's feelings and emotions. Plus dealing with insurance companies.
Oh, that's the best thing in the world.
Yeah.
Yeah.
Plus just everything that's going on in life.
Yes.
But you said you wanted me to kind of go from the beginning.
Just from the beginning, just kind of what got you into the fitness area, like the fitness space. Because you got in the fitness space on the actual personal training side.
Yes.
And now on the more
So I was a
medicine
dancer
side.
my whole life. And then senior year, I got into a bad car accident. My car was totaled. It was flipped. And, I never really knew what the jaws of life meant, but yeah.
They pulled you out like that?
Oh, yeah.
My cousin, they did that to my cousin too. It's got to be the scariest thing in the world.
When I tell you like shaking, like you're unconscious for a little bit. You like completely like don't even know what's going on. And it was the scariest thing. And I was senior year of high school. So it was kind of, and someone went through a red light, hit me from the side, tumbled.
Like T-boned?
Yep. And it was bad. But I didn't break any bones. I don't know how.
All right. So we got She-Hulk in our presence.
Yeah. Right. But I tore ligaments. And I was in so much pain. I could not figure out like what to do. They obviously went to the hospital. They gave me Oxy.
Of course.
And sent me to PT 3 times a week.
Yeah, here you go. Just go and see this person.
Unfortunately, I'm not saying like physical therapy is amazing, but you have to find a good physical therapist. The physical therapy place that I was sent to was like a factory. They didn't even know your name.
Churn you out.
It was like the most simple, stupid exercises. I'm like, I'm not getting any better. I was in so much pain. I refused to take any pain meds. And my mom's friend was like, try acupuncture. I'm like, what the hell? That's like voodoo stuff. I was like, absolutely not. Because I knew that I was going into school for exercise science after. That was like, it was senior year and like, that's where I knew I wanted to go. And physical therapy was actually one of my first choices because I thought it just made sense. Anyway, I was desperate, which unfortunately this happens to a lot of people because they don't know enough about acupuncture and Eastern medicine. Which is sad because it should be spoken about more.
Which I was going to ask you like real quick.
Yeah.
Just like what do you find is the most, I guess, stereotypical summary that people automatically have when they hear that?
That it's not real medicine.
Bullshit type stuff?
Yeah. And I was one of those people, which is why I'm so passionate about being in this field because it helped me so much. So anyway, car accident, desperate, wasn't getting any better, and I couldn't work out. I was in pain. I was in a neck brace my senior year.
Like the dogs after the surgery with the cones?
Yes.
Yeah, that's good.
And I was supposed to compete. I was supposed to do my very first competition.
Dance competition?
No, I was doing bikini.
Oh,
Yeah.
wow.
Yep. And never did it again.
Yeah,
No, that was it. I was like, this is not for me.
I was 2 and done. That was it.
I was like, this is not for me.
Once we started pulling water and I started getting ghost face, I said, all right,
Yeah.
I'm gonna pass on this going forward.
Yeah.
I enjoy water.
Yeah, exactly. So I went to this acupuncturist, and he was a pain management specialist. So he did like extra whatever for pain. Didn't really know much about it. I was like, let me just try it. I swear to you, in 4 treatments, I felt 80% better, where 3 months went by and I felt 0% better. I actually felt like I was getting worse.
Stagnate.
Yeah. And like I said, I refused to take the pain meds. I was, 18, 17 years old at the time? That's crazy. I'm not, I didn't want to go down that road. And he completely like rehabbed me. And it was amazing. And then I already knew that I wanted to go to school for exercise science first. So I got my bachelor's in that. And then I said I want to incorporate Eastern, Western medicine with exercise, because that's everything.
Yeah.
And, I love our medicine here. Western medicine is, we need it.
Yeah, it's amazing. It has its purposes and
it's amazing.
it has its sides, but then there's the dark side of it, which I have a lot of mixed and negative feelings about.
Same.
And there's the dark side of it where everybody gets paid on certain ends, and the consumer or the injured individual usually is the one that gets shafted. And I hate that.
And that also brought me into, once I started having my breast issues, which I guess we'll get into.
Yeah, we're definitely we're gonna get it. We'll start that kind of.
That also made my brain start thinking about, you have to really be your own advocate when it comes to your medical needs, because sometimes there's certain doctors that look at you as dollar signs.
Yes.
And other doctors that are truly in the field for the right reasons, and you have to find who fits best for you.
It's literally like navigating a sea and finding the right people. So
and you have to get something that's integrative. That's why I became what I am. Because
that's why your doctorate is.
Yeah.
And it's in
integrative medicine. So it's acupuncture integrative medicine.
Cool.
Yeah.
So real quick, side note.
Yes.
You treated me for my knee. Remember I was having problems with my knee?
Yeah.
Okay. Couldn't figure it out. Even after the treatments, there was still like some weirdness going on. So I said, you know what? Let me go get checked out by a doctor.
Yeah.
I said, let me just go get me x-rays, whatever, this and that. I go in there. They give me x-rays. Now, I know I need an MRI because you can't see tissue from x-ray.
Of course.
So I go in there, and they go, yeah, we're just going to do an x-ray to make sure the bone, everything like that's good. I said, okay. So the doctor comes in and sees me, and this is just testament to why, number one, I don't like doctors, and number two, why I just understand that they have no fucking clue about dealing with people that are athletes and that push weight and do things and push the body. So he comes in and he just goes, x-rays look great, man. He goes, your knee is, it's like a brand new knee. I said, yeah, that's,
well, damn.
That's fantastic. Right out the crate. Look at that. 30 years old and the knee still looks great. I'm definitely happy about that.
Right.
Especially because of how much abuse on the leg press I've given it. So he just goes, so what seems to be the problem? I said, I've gotten some, scraping work done, cupping and this and that.
Yeah.
I said, and every time I go probably over about 120 pounds on a leg curl, a laying down leg curl.
Did he tell you just to not do that?
I get pinches, I said, and I got to be able to push a little bit.
Right.
So he goes, well, the body is really good at telling us when you shouldn't do things. He goes, so maybe you just don't go to 120. Maybe you just stay at 90. I said, okay, but that doesn't really fix what's wrong with the knee.
Right.
It just kind of makes me throw my hands up in submission like, all right.
You just get aggravated.
Fuck it.
Yeah.
I guess my knee's just going to be like that from now on.
Right.
So he just goes, yeah, well, if you want to get an MRI, you have to get 4 weeks of physical therapy, and then I can write you a script to get an MRI. Cool. I go to Dr. Camp.
Yep.
So I go see Mike. Mike starts putting me through tests, this and that. He rules it's actually my hip.
Yeah.
My hip was too tight, causing...
And you probably had a leg length imbalance.
Yep. Causing pulling in the knee and this and that.
And it probably affected your IT band.
Yep. And he's got a shockwave machine. Have you seen that thing?
Yes.
Okay.
Yes.
That thing is wild.
Yeah.
He goes, it's going to hurt, Nick. It's probably going to hurt. I said, what is it going to feel like? He goes, I can't really show you, so you just got to feel it and see.
That's like how I say when I put the stim on the needle. I don't even know how to explain it to people. I'm like, you just have to let me know when you feel it.
Yeah, I felt it.
Yeah.
Sir, he's moving it around. I said, nope. Yep, there it is. He goes, okay, yeah, right. And he's holding it there for a couple of minutes and letting the tissue break up and this and that. Knock on wood.
Feeling good.
It's been good.
That's amazing.
It's been good. I went to one treatment.
Yeah.
He opened the hip up.
Yeah.
Did a little bit of shockwave, and that was it.
Yep.
But it's just wild. Like the moral of the story, that little excerpt.
Yep.
Is just wild that a medical doctor just goes, maybe just don't do 120 pounds. That's not an answer.
Right.
What are we going to do to fix this?
Well, that's why like I said, why I'm so passionate about being in this field, because the car accident really opened my eyes to a lot, because I was young and I'm a kid. Why should I just be taking pain meds and that's it? Like, that's crazy to me. There has to be something else to help speed up my recovery. And I have so many patients who were diagnosed, some with MS, cancer. I mean, serious. It's not just, I have a lot of patients who hurt themselves in the gym or whatever it is. Love treating those patients. But you see these other patients who are truly suffering with different,
different ailments.
Right. And again, medication is the number one fix. or surgery.
And then that medication has 50 other side effects.
Yes. We do need medication, don't get me wrong, but there's so many other things. And then they're stagnant. They're not moving as much and they're just regressing. It's just sad. So my whole approach is an integrative approach. So I'm combining everything all in one, and it's individualized. So it's not a cookie cutter. So basically whatever your symptoms are, we'll get to the root of it, but it's for you. You might have someone next to you that has the same exact injury, but I'll be treating it differently because the reason why you got that injury versus the person next to you is completely different.
Yeah.
And that's why I love what I do.
Yeah, that's awesome because
Yeah.
the cookie cutter approach does not work, and it's scary that so many people are treated that way.
Yeah.
Because it's just put a Band-Aid on it, go home, whatever. I was actually with and I want you to speak. I was actually with a plastic surgeon because I'm going to start doing some video stuff with him.
Nice.
He was showing, and now I hate needles.
Right.
So he wants me to be in there with him.
Which was part of the reason why I could not treat you fully.
Didn't want to do. She's like, "Can we do the acupuncture today?"
I'm like, all right, so you're barely getting a treatment with me.
Yeah.
Okay, got it.
When's the last time I came to you? Like August, July? I think it's like August, July-ish. Because I got blood.
Was it?
Before I got blood, I didn't see you after I got blood work.
No.
Yeah, so I got
right.
blood work done.
Okay.
I got blood work done.
Okay.
And
Are you good?
usually I psych myself out a little bit.
Don't
but
tell me anything bad while I'm
No.
being recorded here.
My iron levels are high. That's it.
Okay.
But I'm also eating.
Right.
I was also eating probably 2 red meat meals a day.
Ah.
A day. Yeah. So
Okay.
I need to chill out with that. But yeah, the doctor comes in and she just goes, "Yeah, I see you want to get some panels done, this and that." I said, "Yep, haven't had panels done in a while, so
Yeah.
it's more than time." The coach that I work with down in Florida gave me all the panels that he wanted me to have
Awesome.
run, so I give them to her. And here I'm in my mind, I'm just going, "Nick, we're doing good, man. No nerves, no
Right.
nothing. We're good."
Don't tell me pass out.
Well, she goes, "All right, we're gonna do the blood work first before everything else." I said, "Oh, you're gonna do it now? You're gonna switch up on me like that?" I was planning mentally that we were doing this at the end, and she goes, "No, let's do it. Let's do it now. Get it right out of the way." Ties me up. I go, okay. I said, "I'm gonna slap my."
Feeling great.
I said, "I'm gonna slap my knee right when you put the needle in." She goes, "Please don't move." She's trying to put the needle in my arm. She goes, "Please don't move." She does it. I'm good.
Oh man.
45 seconds go by, and I go, "How much longer we got?" Because I'm starting to waver, and my mind's playing tricks on me. She goes, "We're almost done, almost done." She releases the rubber band, takes the needle out. She goes, "You're done." I said, "Oh, okay." And I laid back,
No.
white as a ghost. I didn't pass out.
Okay.
But I was white as a
I'm surprised
ghost.
they didn't bring the salts over to you.
No, but luckily they brought me a little cup of water. They brought me a
Perfect.
sucking candy. I was sitting there.
Oh.
I said, "Oh, good. I
Nice.
get a candy. Everything's great."
Nice.
But yeah, so they did that to me, and I will tell you, I was worried all summer though because I thought I had high blood pressure.
Mm-hmm.
Because I was trying to diagnose myself. I was having those
Right.
weird neuro stuff.
Yes.
I bought the blood pressure monitor from Withings or whatever.
Okay.
And every time I would put it on, it was like 140 over 90 or 80. So then it was like 150. And it was like staying around
Was
that
it reading
area.
you properly?
I was so nervous. So then when I went to her,
Yeah.
she ties me up. Perfect blood pressure.
Yeah, I
She
wouldn't-
said the smaller cuffs for guys that have bigger arms, the smaller cuffs always read high.
So really, she gave you a big compliment.
She did give me a huge
Yeah.
compliment. I said, "Oh shucks, you're gonna sit here."
You're saying I have a big arm? Okay.
Yeah, you tell me I got big arms. You bring me a lollipop. Everything's great right now. But yeah,
She's just like the perfect girlfriend.
it was good, right? Oh my god, it's compliments, food, everything's
you
great.
candy.
Everything
Great.
is great.
That's awesome.
Just don't have a white van and ask me to come into it.
You probably still go.
I probably would. Yeah. Knowing me, I'd probably go. Like, oh, how much? Sour Patch Kids? Yeah, let's go. We out. So you got into
Oh, man.
into that side of it.
Yes.
And you started to appreciate a different form of medicine.
And
It's
also
kind of where we're at.
because I physically felt it. It wasn't like I just went into this field because it was something that I was interested in. Of course, I'm interested in it, but it was something that helped me. So why not, embrace it and show other people that there's other opportunities and different options rather than, and that's the problem. I think integrative medicine, Eastern medicine should be, majority of the time your first option. And if that can't help and it's too severe that you do need medication or surgery, then absolutely go down more of the westernized route. But it's always the last resort. So by the time people usually come to me, unless they already know about it, they're coming to me and they've already been suffering for years. They are on a shitload of medication. They have had numerous amount of surgeries. And it's like, now we're dealing with chaos rather than a clean slate.
Yeah.
And it's difficult. You know what I mean? That's why my treatments are an hour. You know, I don't just see a patient for 10 minutes. I'm with them for a full hour every single time.
Which is awesome because I've gone to people that kind of rush it, and it's nice when someone spends the time because you feel like you're getting it out. You're getting a lot out of the appointment.
Right.
You're not just okay, next, like that conveyor belt type
Absolutely.
feeling.
And you need both medicines, 100%. I mean, look at everything that I just went through. I appreciate Western medicine so much.
Yeah.
You know what I mean? But my recovery was 10 times better because I was treating myself. And
Which I'm sure helped a ton.
Oh, tremendously.
Yeah.
Tremendously. They thought they had to do another surgery, and I was able to fix it. And he was like, oh, we don't have to do it. I was like, thank God.
Yeah.
Yeah.
Yeah, because you went through...
I mean, I'm getting another surgery, but that's for another...
Yeah, you told me.
Yeah. Second part of it, always.
Is it?
Yeah. Usually there's always like a second part to the double mastectomy, unfortunately, to kind of more reconstruction. But I'm also having issues with one side that unfortunately you don't really know. Like nobody really warns you about these things. And that's why I'm such a big advocate to talk about
Which is why
things.
we're going to go A to Z.
Yeah,
and
perfect.
Although this episode is about you as a whole, this episode also is about warning women.
I hate really talking about myself. So if we could talk about breast cancer, I'd be very happy.
We can. We definitely can. I think we'll end off on the medicine stuff. So when did you, I think we'll end off like this.
Yeah.
When did you get your final doctorate? Because I know that was recently.
So this was this past January. Yeah.
Congratulations.
Thank you.
Hard work.
Yes.
A lot of hard work. How many years?
Yeah. A lot of many years.
Many years of studying and classes and
9 years total.
Yeah.
8 years total.
And here you are making a huge difference in how
years.
many people's lives. I mean, so that it's worth the investment.
My practice, my patients are like my family. Like that's the thing. I know everybody by their name. I see usually anywhere from 30 to 35 patients a day. And every time it's an hour. I usually see 3 people in an hour, 4 maybe, depending. But I work a full schedule, and every single patient is embedded in my brain. Like, I truly love them, and it's just amazing seeing their success, and it's just, I know I'm in the right field.
That's awesome.
Yeah, I love what
that.
I do.
I love that. So
stressful, but I love what I do.
Yeah, you're like anything. This stuff is stressful too.
Oh, yeah.
I get it. So we all have our own individualized stressors for every job.
If it wasn't stressful, then you're probably not doing it right.
Yes.
I hate to say it.
Yes.
Yeah.
As you can see, I'm still trying to organize. I just set up a new thing. That's my new monitor over there. That's my old computer. And this is the new computer. So I'm trying to rearrange things and clean things out.
The alcohol.
And the alcohol. Yeah, there's just alcohol there. If you want to booze mid-podcast, it's there.
I love it.
We try to be a good host.
I love it.
You got puppy you can scratch, alcohol you can drink. What more could you want?
You really can.
I know.
This is everything.
So I think it's important, obviously, to give our female listeners every possible
detail
and piece of knowledge about your journey, what you went through before, prior, finding out. The females that I've spoken to about you coming on, they've been so interested in hearing it because it's something that people can't shy away from. You have to face this literally head on.
Yeah.
So what kind of got you the first dose of information on that?
So,
and what is it called officially?
So since I was 19 or 20 years old, I started developing tumors in my left breast. And since I was 20, I'm 28 now, I've had 11 biopsies. And anyone who's had breast biopsies know that it is like inhumane. It is not fun. I mean, you're awake. Let's just put it that way.
I didn't know that.
And you're basically being held down, and there's this like huge needle-looking vacuum, and they're clipping away, sucking out, clipping away, sucking out. And you're numb, but to get you numb, first of all, is painful.
Yeah.
And so anyway, when I was 20, my gynecologist actually felt a bump. And she was like, I really want you to just go get it checked out. You're young. I'm sure it's nothing. I said, okay, fine. My mom came with me. And breast cancer does run in my family. So, but I thought I was like, I'm younger.
Nobody has the thought.
Something.
No one has the thought that it's going to be me. So
Right. So they're doing the sonogram. And every 5 seconds, she's clicking more stuff into the computer. And I'm like, oh, well, this is taking pretty long. I thought this was going to be like a 5-minute thing. And then they said, the radiologist wants to speak to you in her office. And I'm like, okay. And she asked me if I had anyone with me. I was like, my mom's in the waiting room. You know, I'm 20. And my mom comes in. She sits us down. She goes, she basically flat out said, it looks like cancer. And we have to biopsy right away. And she said, you have four tumors in your left breast. So with that said, we're going to schedule you this week for 4 biopsies in one day. So
one biopsy is tough.
Yeah. So 4 biopsies in one sitting was my arm was numb. I can't even and I will never forget there was a light fixture on the ceiling that had dust, and I'm watching it, and I was just like trying to focus on the dust because
Anything but
I
what
was
was
like,
going on.
Yeah, and the sounds. I was mortified. Anyway, they came back benign, thank God, but they were solid lesions. They were not cysts. They were solid tumors. So from that point to now, I kept developing more and more tumors. For whatever reason, couldn't figure it out. Thank God they were all benign, but 11 biopsies since I was 20.
And what type of a scar do biopsy? Is there any scarring, anything like that that you see outside?
Yeah, you have like little
Micro incisions?
Yeah, like the size of your fingernail.
Okay.
But they place little titanium clips in there so that every time you go for a sonogram, they can see where they took a biopsy from.
So to see if something else is growing in its place.
But every time I would go for my sonos, the tech could never find my clips because my breast tissue was so dense.
Great.
Now, that's another issue. When you have very, very dense breast tissue, as a female, you think it's great because, I hate to say it, but you have perky boobs. You think it's great, right? Not so great when you need imaging done and everything else because things are lost in there. You can't see anything.
It's much harder to detect.
Yes. So then I would have to get MRI with contrast and everything else. It was just every 3 months because I was on high, they had to constantly check me every 3 months. Every 3 months, more biopsies. Every 3 months I would go for sonos. They could not find all my markers in there. And it became
It was just a
chaos.
round robin of
Yes.
just bullshit annoyingness.
Right. So finally,
Mandatory annoyingness that you had to keep going
Exactly.
for, but
Yes.
annoying nonetheless.
Right. So then I got genetic testing because I do have a family history of breast cancer and pancreatic cancer. My Nona passed away from pancreatic cancer. And I came back with a gene mutation that increases my risk tremendously for breast cancer. Now, the most common is BRCA1 or 2. I have the ATM gene mutation, which when I heard that, I was like, ATM, am I going to make a lot of money? You know what I mean? But unfortunately, it just meant you're going to develop a lot of tumors.
It's going to cost a lot of money. That's what it is.
Exactly. I had a breast surgeon who I was with majority of my 20s. He was a great person, great guy. I'm not going to say any names, but unfortunately, it was very... biopsy. And I'm like, this is not a way to live. And I said, let's talk about some other options here because now you tell me that I am positive for a gene mutation that increases my risk for breast cancer. I have a strong family history of cancer, and I've had 11 biopsies in one breast. To me, that says something.
Where's the treatment plan instead of just preventative?
And at the time, he said there's always tamoxifen.
What's that?
Which is a very heavy medication that will basically almost like chemo in a sense.
Great.
So I don't have kids yet. Why would I ever want to do that? I would not want to put anything toxic into my body unless it was necessary. And to me, I was already thinking of a double mastectomy at that point because I'm like, I would rather take the step to fix this, that I don't have to worry anymore, than to, God forbid, have a baby and while I'm pregnant or right after because of the hormone spike. And a lot of times that will
trigger cancer cells.
Exactly. And then I have breast cancer and I can't be with my child. And
now you're fighting that battle.
Right. And I can't wait to be a mom. That is like, love my career, but that is like my biggest passion in life is to become a mom. So it was like, which one? Do you know what I mean? Started searching around. I found an amazing, amazing breast surgeon who looked at me and he's like, you're a ticking time bomb. I was like, thank you. That's literally how I feel.
Yeah, I'm sure that helped reaffirm your feelings on everything.
And I went to Sloan. I went to so many different doctors, and they all looked at me like, double mastectomy is a very smart choice. And I'm like, I can't believe that I didn't make this step yet. You know what I mean? 11 biopsies later, you probably would maybe think that. But it's not for everybody. Not everyone. Some women think that a double mastectomy is the worst thing that could ever happen to you. And I get it. I totally understand that. But I think speaking about it more can help, I don't know the right words for it, but help women understand that it's not, you shouldn't be ashamed. You shouldn't feel deformed. You should embrace it and say, listen, this saved my life.
You're taking your health into your own hands.
Right.
So now real quick, and I want you to continue
Yeah.
on with that. How do you get the testing done for the gene mutation?
It's a blood test.
Just a blood test.
But the problem is, if most insurances will not cover it unless you basically check off enough boxes. So you have to show that you have a real family history. You have to show that you've had something going on. I mean, I've had 11 biopsies, so enough was being shown for me. My sister is actually having a hard time getting the test done because she's never had any biopsies, thank God. But now that I am basically perfect person to show that her sister just had a double mastectomy due to all of this, now she's been accepted through insurance. But you're jumping through hoops sometimes.
It's so annoying.
Yeah.
It's such a...
Yeah.
Well, we can't approve this and this and that.
And you know what's crazy, though? A lot of women who have breast cancer don't have a gene mutation. So for that reason, I honestly feel very, very, very thankful because, and I know it's scary to get the genetic testing done because sometimes it's better to not know, or at least you think that.
Well, that's the thing. If you don't know, you're not going to worry about it.
Right.
But when you do know, now you're in almost a frenzy trying to
Right.
figure out what you got to do to just prevent it even further.
Exactly. And that's something, it's funny. Through this process, I've met so many women now who have, fought against breast cancer and have had all these double mastectomies, and everyone's journeys are so different. And it's amazing hearing everyone's stories because these women are strong. I mean,
yeah.
And I look at their stories and I'm like, I dealt with nothing. Like, I look at my journey and yes, it was difficult. And, it was my entire 20s was revolved around breast issues, which is not fun. You know what I mean? And fear, constant fear. 2 Thanksgivings ago was when I really realized that I needed to find a new doctor because they found 3 new tumors and one was in my milk duct. And they were like, we're not really sure if we can get a valid biopsy to show that there's no abnormalities. I'm like, so I'm just going to wait again and just hope for the best? This is crazy. This is insane.
There's got to be something else, is
Right.
essentially the
Right.
feeling.
Exactly. So I found, what was I saying before?
You said you found an amazing breast surgeon?
Yes.
Okay.
And he was basically saying, you check off every single box. He was like, I'll be
Ticking time
honest.
bomb.
Yeah, you're a ticking time bomb. He's like, I'll be honest with you. I don't even know if you don't have breast cancer. He's like, I would 100% want to do a double mastectomy on you. At the end of the day, it's your choice. And he wants to go in and take out more lymph nodes than a regular prophylactic double mastectomy. And a prophylactic double mastectomy means it's a preventative surgery.
Okay.
And I guess it's considered an elective surgery, which a woman told me who had the same surgery done, and she was like, it really bothers me when they say it's an elective surgery or a preventative surgery when the other option is cancer. So you're kind of pushed up against a wall. What do you do? It's not like you can say, yeah, I'm just going to wait and the chances of me not getting breast cancer is very low. It's not. It's most likely you're going to get it at some point in your life.
When
It's
you
just
have that gene.
Right.
Okay.
It's just when. And the very dense breast tissue, like I was checking off a lot of boxes and family history. So I said, okay, absolutely, let's book this double mastectomy. And
So what were your feelings like at that point?
Fear was biggest one. I take good care of my body, and I was kind of like questioning. I was like, I can only imagine what I'm going to look like after this. And I was nervous about what I was going to look like, in all honesty, which sounds very superficial, I guess. But
In all fairness, you have to.
yeah,
I mean, that's a
I
huge
started
part.
Googling pictures, and I was like, oh my God, I don't think I'm ready for this to look like this. But at the same time, do I really want to get that cancer diagnosis and then go through chemo, radiation, everything else? I mean, I saw what my cousin went through, and it runs in my family. And it was definitely scary, but also I finally felt like there was a solution because I did not want to go through these biopsies anymore. It was taking over my life. And every time you get a biopsy, you have to take off work. Like, I know that work should not be everything, but when you work so hard.
And you're an entrepreneur.
Yes.
You work for yourself.
Yes.
So if you're not
I don't have
there,
people covering for me.
Exactly.
And we all know when you leave it into other people's hands, what happens.
Doesn't get done as well.
Right. So, and I felt like it was like so annoying to constantly tell clients and patients, I'm sorry, like I have to take off this day. I'm sorry, I have to take off this day. And I was getting these biopsies done when I was in school too. I had my finals, my exit exams, my board exams. I will never forget, I had a biopsy the day before my exit exam and I was wrapped up and my boob was just throbbing. And I was trying to focus on the test.
And it's just
and it was just
like when you hit your thumb or something, right? Just like pulsating.
Yeah.
Oh my gosh.
Yeah.
I could only imagine.
And my surgeon was like, I'm going to send you to the plastic surgeon that I work with. He's amazing. They're an amazing team. They were in the operating room together, which usually that doesn't happen. It's usually the breast surgeon first. They do the double mastectomy. Then the plastic surgeon comes in and does whatever reconstruction.
Same day?
Same day.
So it's long.
It was a very long surgery. It was almost 10 hours.
Oh, man.
Yeah. Yeah.
But that's got to be really good, like you said, to have both of them in at the same time,
Yeah,
so
and
they
it was
can
like-
talk and know what's going on.
It sounds disgusting, but he was literally gutting me. And then he was right there reconstructing me. And it's amazing.
I'm sure that actually helps the reconstruction process when the plastic surgeon can actually see what your normal breasts look like.
Yes.
And
yes.
he models it after that.
And I will say, my plastic surgeon was like, I will not put huge implants in there. It won't fit your body type. I want you to look natural. And he's amazing. He's amazing.
So you had a really good team, which is so important.
So important.
If there's
And
anything that you stress besides getting tested, it's finding the right team.
you have to find doctors that you trust, you can communicate well with, and that's a huge part of it. It's a scary process. No one wants to go through it, and it's been a lot. And even just after the fact, nobody really preps you for the aftermath of the double mastectomy. You kind of think like, oh, double mastectomy, you get implants, you're good, you're done.
It's like a boob job, right?
Yeah.
no,
Oh,
not
that's
like
another
that.
thing. When people say that, it's like, and I don't mind it because I don't really get like insulted by that at all.
No, but I'm
because-
sure that's a huge insult.
Yeah, but it is not a boob job.
Yeah.
At all. I mean, let's just talk about.
So here, let's do
Yeah.
this. Let's do this.
Yeah.
So let's do this.
There's so many parts to this.
So I want to go. I want to back up for 2 seconds, and I want to go back to. Obviously, you were feeling all those emotions.
Yes.
So now, how long from when you booked it to when you actually had the procedure?
I booked it probably 4 months before, and
Okay.
so I had it in about 4 months of the day that I
And
booked.
the waiting time between the booking and then the actual
Oh.
appointment. What did that feel like?
My whole life revolved around researching
Okay.
and probably looking at stuff I shouldn't have because
It probably helped and hurt.
yeah, but I met amazing women on Instagram, and that's where social media does play, it is beneficial in certain
Important.
ways because I found young women who were going through the same stuff, and I DM'd them, and I'm still friends with them till this day. And they helped me tremendously, and then they put me in contact with women who were about to also get a double mastectomy, and I already had my double mastectomy, so I was basically their guide, and I mean,
Passing the torch.
Yeah, literally.
Yeah,
Literally.
It may sound bad, but that's so positive
Yeah.
because I can only imagine that would help if I was
Yeah.
going through something like that, to have somebody else that just went through it,
Yes.
ease some of my tensions instead
Mm-hmm.
of reading Google and reading all of the. I mean, listen, every time you Google a symptom or an ailment that you're going through,
Yeah.
you're dying, you're dead.
Yeah.
You're gonna die right now.
Yeah.
Like that's what it is.
Yeah.
Oh, you stubbed your toe, there's blood. Nah, you're dead.
It's so true.
So to read all the negative things and the
Right.
and misinformation and all the misdirection and to have somebody that actually
Yeah.
experienced it.
And hearing the good, the bad, the ugly. Like this one woman, Xandra, I can say her name because she's a big advocate for all of this. She's amazing.
Shouts to Xandra.
Yeah, seriously. And she was texting me everything that I should have in the house prior. She had an infection right after her double mastectomy. I ended up having an infection right after my double mastectomy. That was probably the worst of it all. I had a 103 fever for 3 days in the hospital, and then when I got home, it spiked up again. My body was rejecting the drains. It was a foreign object in your body, and your body was reacting to it. when you have huge incisions on your chest and you feel like crap and you have a fever, the chills, you're dripping sweat, cold sweats. That was the worst of it all. I mean, you couldn't even feel better if you tried. It was bad. It was a scary time, but at the same time, you had to get through it. What are you going to do? You had to push through. And I just kept telling myself it could be so much worse. And I hate even complaining about it. And I actually get so angry at myself because I did not have it as bad as some of these other women. I'm still alive. I was able to find out that I had a genetic mutation that increased my risk for this.
Even more so than you already thought.
I was able to act on it. Exactly. I was able to act on it. And I've met many women who are afraid to get genetic testing, or they know they have a gene mutation and they refuse to get a double mastectomy. And I completely understand it. It's not an easy choice. Some people would rather wait and hopefully if they do get diagnosed with breast cancer, they will get it cut out. You know what I mean?
They tackle it at that point.
Exactly. But I need to just keep pushing forward. I can't wait. I need to figure things out and solve it at that time. It's been a journey. That's for sure. And it's not over because after when I woke up from surgery.
So let's actually, surgery. So the actual double mastectomy itself, what does that entail? Because it's more than just chopping a breast off.
Well, that's the thing. When you first hear double mastectomy, you think that, breast tissue is just going to be removed and that's it. No. First of all, a lot of people don't realize you have breast tissue going into your back. So over like your lat muscles, you have breast tissue. You ever see like your back fat, like women wear the bra and they have like that little fatty area?
Yeah,
That's breast tissue.
I have that.
Yeah. Well, you don't have to wear a bra, so it doesn't show.
I don't, but I do. I need more support.
That's breast tissue. So they have to cut that out too. So they literally they're gutting you from everywhere on your chest into your back, and then you get lymph nodes taken out and they get tested to make sure that, and God forbid, they do find any abnormal cells that it didn't,
travel through.
Right, exactly. And my incisions run underneath. So basically with the implants in, you don't see it, I guess, as much. I mean, I can't even wear
You're saying they run underneath the breast.
Right. So it's basically center of my chest. It kind of makes like a little U, and then all the way up to my armpits.
Okay.
So regardless,
kind of how women get that tattoo.
Yes, exactly.
Like that?
Yes.
Okay.
But it travels up higher because
back.
they have to go in for the lymph nodes.
Okay.
So even I tried wearing a bathing suit for the first time, a bikini over the summer, and I was like, oh God, no, I am not ready to show these scars off yet because they're thick, they're large. It's not a boob job scar. Okay, and that's one thing. That's another thing.
You hear it?
Yeah.
It's not a boob job scar.
It is not a boob job scar. Boob job scars are great compared to a double mastectomy scar. Another thing that they don't tell you about is all your breast tissue is taken out, right? So now it's literally just thin skin and an implant, okay? I didn't know. I went into a sauna for the first time since my double mastectomy not too long ago, and I thought I was burning from the inside out because my implants were getting hot.
Wow.
Yeah. And
I wouldn't think that.
So because there's no fat now, there's no breast tissue, there's nothing helping to kind of cover.
That's true.
Yeah.
Don't they usually put the implants under the under tissue? Or under the muscle? Is there some under the muscle, some on top of it?
Depending on who your surgeon is, and I guess like your anatomy, how your skin plays a big role because it also depends on what size you were prior to the double mastectomy. So there's a lot of factors that play in. I actually had a boob job before my double mastectomy the year prior, knowing that I was probably going down that route to stretch out my skin because I was smaller. And when they do a double mastectomy, they're making you smaller regardless. So then they usually put in expanders.
Gotcha.
And then they pump you every so often to stretch out your skin.
Okay.
So now that makes your recovery time a lot longer. So I thought in my head, okay, you know what? I don't have breast cancer right now. I'm going to do everything I can to make this as quick as possible. And I got a boob job.
Okay.
Thought it was great. I was like, wow, I'm going to keep this going for as long as I can. And then that's when Thanksgiving happened and they found more tumors in my milk duct.
Gotcha.
And then that was basically the turning point of, yep, your boob job days are over. And those implants have to come out. Those were behind my muscle because that's another thing. if you have very dense breast tissue or you're a high risk for breast cancer, if you have a surgeon that is willing to put implants above your muscle, you are with a bad surgeon.
Yeah, run.
Yeah, because when you go for scans, they won't be able to see if you have any tumors.
That's what I was going to ask. They can't
Yeah.
see through that.
Right. Once you have a double mastectomy, it could go behind or in front because there's no more breast tissue. But yeah, there's so many different reconstruction areas that you can go. It all depends on your anatomy and what size you were prior and the texture of your skin. Some people have thinner skin, some people have thicker skin, and your skin will always become thinner after double mastectomy because they're literally scraping you from the inside out, basically.
Okay.
Yeah.
And you said you went bigger, so this way your skin was already stretched out. So how? And you said that
Exactly.
helped the recovery time a lot.
Big time.
Okay.
Big time. So that's why I was able to get the implants put in the same surgery.
Gotcha.
Usually it'd be separated into two.
That's good too.
Yeah.
Yeah. The less surgeries, the better.
Yeah. And again, that's why I also feel like I'm super thankful for all of this because I had time to get implants before my double mastectomy. So it's like I had time to kind of navigate through this, whereas other women get a breast cancer diagnosis and they're put in a corner and they have to make all these decisions, and I can't even imagine. That's why if I could help anyone going through this, I want to, because I feel like I had it the best case scenario for a shitty situation. So might as well help as many people as I can.
Yeah.
You know?
Well, that's it's important. And I think all of this information, I know
Yeah.
all this information is super
Yeah.
relevant to every female that will listen
Yeah.
to this episode.
And then another thing that no one warned me about is cording. So where they take the lymph nodes out of, which is basically like under your armpit, they go deep in there and they take lymph nodes out, right? There's so much scar tissue. They still don't really understand what cording is actually made out of, but it looks like you have an extra ligament popping out of your armpit or chest. It could be anywhere where they did the surgery.
Okay.
There's definitely scar tissue in there. They think maybe lymph fluid, nerves, whatever it may be, but it literally looks like a rope. And it is so tight. So I had it on both sides. So when I tried to raise my arms, my range of motion was terrible.
Oh,
I
man.
treated myself, and that's why I think in some ways I can be so much more empathetic towards patients who have had this and treat them for it, because I treated myself for it. I got my left side to go away. I am full range of motion now, perfect, good to go. Right side still having a little bit of a struggle with, but I mean, this side, it's thick. It looks like a rope. It's crazy. It's insane. And if I raise my arm, it like pops out.
Oh, man.
Yeah.
Oh, lymph node stuff freaks me
Yeah.
out. It just
And
screams me
eventually
out.
it will go away, but I just, almost hit, I'm 8 months? What am I? I don't even know.
Yeah, so
March?
how much quicker is this than the normal person?
Right, exactly. Like other people, I know women that have had a double mastectomy, they come in for treatment. They had a double mastectomy 5-6 years ago, and they still have the cording. They've never gotten treated for it. They didn't even know there was treatment for it.
They just thought that it was part of the process.
Exactly.
And that is what it is.
Exactly. So I am a big, big, big advocate for get treatment right after your surgery. You should find either a physical therapist, acupuncturist, someone that's in that field that can treat you for that, because it's a game changer.
Oh, I'm sure.
Yeah.
I'm sure that's a huge slap in the face when you first come out of surgery, especially, and the weeks, months leading after that.
Yeah.
To, wow, everything's going to start getting back to normal. And then you start dealing with new ailments that you
Right.
didn't think you were going to have.
Right.
So you're done with this, the surgery, they do the reconstruction, they do everything right then and there.
Mm-hmm. Yes.
What was it like when you first woke up?
I didn't even know where I was, to be honest with you. I was on morphine. I can't even, yeah. Nurses were great. They were
That's
very
awesome.
nice to me, but I was in the hospital during COVID. So when I woke up, I didn't have any family members there with me. I was in a lot of pain, and that was with
Morphine.
heavy meds and still coming out of anesthesia. The worst pain was my back. It felt like I had a blowtorch in my back. And I kept asking the nurse, I was like, why does my back hurt so much? Like, do I have a burn back there? And she was like, no, sweetie, like that's where they took out breast tissue as well. And my drains were tugging, because you're kind of in this like.
So I was going to ask you, drains
Yeah.
why do they add drains? What do they need it for?
So it's just
Is
to
it just-
help basically drain fluid extra
coming in.
fluid that's
Okay.
there because you're so inflamed. I mean, I looked down for the first time when I was in the hospital. I was at St. Francis, great hospital. And I was there for 4 days. And I will never forget when my surgeon came in and he took off the bandages and he's like, you might not want to look because this is not what it's going to stay like. So he's like, a lot of women would rather not look because otherwise you go into like a very dark place just seeing what it looks like down there. Of course, I wanted to look. And I looked down and it just looked like a mound. Like I did not even see 2 breasts. It just was like one large mound and that's how inflamed I was. Arms looked like someone like balloons. I was so swollen. Yeah, it was interesting. And then I got an infection.
So that happened in the hospital?
Started
Or
in
when
the
you got
hospital,
home?
but they didn't realize that I actually had an infection in the hospital, so they sent me home. And once I got home, that first night, I was chills, fever. I was hallucinating. It was really bad.
Really?
Yeah.
And so then what happened? You
I
had to go back
call
to the
my
hospital?
surgeon right away, and they said, go back to the hospital. And then they put me on different antibiotics because apparently those antibiotics were not working well with me. And it fixed it, thank God.
You said your body was rejecting
The drains, most likely.
the drains. That's what it was. Okay.
Yeah, because the implants have been in there and they've been fine.
And you didn't have the same type of implants? Because I know there's different kinds.
Yeah, so there's the silicone implants is what I have, and they put Alloderm around it, and then that's basically what I basically sew into the pec muscle to hold it.
Gotcha.
A lot of different steps.
Yeah.
Yeah.
It's a lot.
Yeah.
But important.
Very
because,
important. Yeah.
Otherwise, people that are listening and people that potentially would have to go through this. And listen, even for men listening to this episode,
yeah.
this is huge because men can still get these types of things.
Absolutely.
And if they're female, their wife or family member or anything like that goes through something like this, at least they have an idea and an understanding of what kind of goes into it.
And something, I guess, too, sounds so stupid, but, it was a very long surgery, and I've always had very healthy hair. I was always like all about my hair. Ever since that surgery, I've been losing hair. Like thank God I have a lot of it, but shedding.
Really?
Like tremendously. And I guess it's all and I asked my surgeon, he's like, unfortunately, you were under anesthesia for so long and it does affect it.
Really?
Yeah.
So for how long?
We're going to see. I have no idea. I take my vitamins. I'm on point with everything. I eat well, but it's like sometimes you just can't change certain things. And yeah.
And you said 10 hours.
Yeah.
That's the longest surgery I assume you've ever been in.
Yeah.
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 That's wild. I think I was out for 20 minutes for my nose.
Yeah.
And that
It was 8 to 10 hours. Yeah. Yeah.
So now you get rid of the infection. Mm-hmm. And to walk me through some of the weeks after post-op.
Drains were a bitch. I'll say that right now.
And how long are they in for?
I had them in for 2 weeks. 2 weeks. You feel them inside you.
Moving or are they stationary?
It's like tugging. They're stitched into you. Oh. So they're stitched into the side of you.
And where do they go? They're just
they
fluid
go
bags?
straight into the top of your chest.
And where do they hang, though?
Oh, you have thank God my surgeon gave me a drain belt, and you basically wrap it around your waist and you put the drains in the belt, and so it doesn't tug on your skin as much. But you have to drain them constantly.
How many times a day?
4.
And where do you drain it? Just in a sink?
In
or
the toilet.
Toilet?
Yeah, but you actually have to put them in a measuring cup.
To make sure there's not too much fluid coming out.
Right, and the color, texture, there's some nasty stuff that comes out of it, and that's also a way to see if you're getting an infection. And when
Gotcha.
I had the infection, it was definitely different. It was thick.
I was about to say,
Yeah.
what did it change? Color?
Yeah, it would change color. It was very, very dark, and it looked like I had clots coming out.
Oof.
Yeah.
So that's super important.
And my breast. Oh, so also the side that I had all the tumors in.
Left side.
Yes. They actually found, so thank God my doctor wanted to go in and take out more lymph nodes than a regular prophylactic double mastectomy because he said, you check off so many
Boxes. Yeah.
and they found one abnormal cell in my left lymph node, and that was the same side with all my tumors. So clearly it was brewing, and it was just a matter of time.
And you had mentioned that they said if you had gotten pregnant.
My surgeon was like, I am so happy you did this now, because one of these tumors most likely would have switched, especially knowing that this one cell was in there and the gene mutation that you have. And God only knows what would have happened when I got pregnant.
Yeah.
Yeah.
That's huge.
Yeah.
I'm sure that was a
Big relief. Yes.
yeah, big deep breath after hearing something like
Yeah.
that.
Yeah.
Almost reassuring that you
And
made the
that's-
really right decision.
That's something I also want to tell women who decide to get a prophylactic double mastectomy. Majority of the time, nothing will come back abnormal. And that's not a bad thing. Like, you still made a good decision. Do you know what I mean? Because I was struggling with the thought of, if everything comes back completely normal, did I do this for no reason? Because you every day you're second guessing yourself every single day, because I mean, this is a huge thing. You're getting your boobs really chopped off.
I can, once again, I've said it a million times this episode, I can only imagine.
Yeah.
Because I can't
Yeah.
understand that. But breasts are a huge,
Oh.
huge part of,
Yeah.
of females. Literally.
I mean, look at how many boob jobs are out there
Yeah,
to
it's-
enhance it, because it is such a big, it's a feature. What are you gonna do?
Yeah,
you know
it's
what
a
I mean?
feature, and it's
Yeah.
and it's womanhood
Yeah.
too. It's for
And speaking of that, I think something that I struggled with the most was knowing that I can't breastfeed.
okay.
It bothers me. It still bothers me, because again, I can't wait to be a mom. But then again, like, you know how many women look at me and they're like, "Please, Marina, like, I never even tried to breastfeed. I put my kid on formula right away. It's fine."
My mom was sick.
Yeah.
My mom was sick right after
Yeah.
she gave birth to me. I was on.
Oh, so you're a formula baby.
Formula baby.
Thank God. And you're here.
I'm okay.
You're smart.
I'm doing okay. Sometimes
You got big arms.
big arms, right? The doctor sometimes says, a little off, but
Yeah,
whatever. I think it was a bad batch.
But yeah, so I had to come to terms with that, but that was like the least of my worries
That's what I was
at
about to
that
say.
point.
If that's the least
Right.
biggest thing
Right.
that you got to deal with,
Right.
or that's the biggest thing
Yeah.
for you, and
my surgeon was able to keep my nipples. That's
There you
huge.
go.
That's huge. Not to put out too much information, but it's a big
No.
part of it.
I was about
because-
to ask, like,
Yeah.
so you said it was just 2 mounds.
So yeah. So he even told me, he goes,
And why can they not normally keep the nipple?
so if you already have breast cancer, a lot of times they will not keep your nipple,
Really?
because
It'll produce cancer cells?
well, you have all these ducts that come out of the back of your nipple. They will skim that out. So they're basically, it's just there for looks. It really depends on your case, because there's also breast cancer in the milk duct. So there's all different types of breast cancer. If
and
have,
you had tumors growing in the milk
in
duct.
the milk duct, yes. So they actually tested the back of my nipple, and everything came back clear. So they were able to
That's
keep my
good.
nipple. Yep. There's nothing behind it, so it's really just there for cosmetic looks.
Aesthetically.
Yeah. And hey, I'm happy with it. At least
That's-
I got to keep one thing of mine.
I could definitely relate that I would like to have
Yes.
kept my nipples.
Yeah. Yeah,
I would've-
right?
I'd have been
And
like,
especially if you like your nipples, you
I'd be
want
like,
to keep them.
hey, Doc, I had some good looking nipples going in this and you kept them. I appreciate you. So that's good news.
But that's another thing. Again, why I say I'm lucky, because a lot of women have a scar that goes straight across, and
Oh, across where the nipple would be? Mm-hmm. Oh, okay. Mm-hmm. So now you said the scar is underneath
Yes.
for you. Mm-hmm. And why would they? I mean, every case I'm sure is different.
every case is different.
but
it all
it's not
depends
just
on why.
they don't take it the same way. That's interesting.
Nope. All depends on where your cancer is, the type of cancer. Is it invasive? Is it a prophylactic double mastectomy?
But they're scraping it out regardless. I would think that they would be able to just do it anyway.
Yeah, but if they're not keeping your nipples, then it makes more sense to go this way.
Underneath.
So no, straight across. If
Oh, they're not keeping it.
if
Oh, I
they're
thought
not
you meant.
keeping
I thought you
know
said
what
they're
mean?
keeping it. Yes,
Because
yes.
then you're getting scar here and scar here. That's it's all over the place.
Yeah, you don't need that.
They try to keep the same lines, which I guess are good.
Yeah.
Yeah.
So the weeks leading after it, drainage, and then what else kind of what were
My
some of the
biggest thing
pitfalls?
was trying to stay active. And when I say active, I mean like literally walk around the house was the most I was doing. But that helps a lot. Like, you need to be motivated enough to get yourself moving, because it's very easy for you to just stay in that bed. You're medicated. I mean, I'm not one for pain meds, but you need to be on the pain meds right after that. That's
Oh, I'm sure.
it's
I'm sure.
brutal. Yeah. But I will say I had my first time ever realizing how strong pain meds are because I kind of stopped cold turkey, which was stupid, and I should have weaned off them.
Was it too? And did you stop too quick into it, or were you right around
I
the
probably
time?
stopped too quick because in my mind, I'm like, I don't need these anymore, and I'm gonna just deal with the pain.
That's how I'd be.
Right. Stupid. Because I was taking them on the clock. Like if I even went past a half hour of when I was supposed to take it, crying in pain.
Really?
Yeah. So it keeps you at a good
Pace.
yeah. I thought I was doing well. I was like, I feel pretty good. I walked today. I'm doing great. And my mom was like, Marina, you need to take it. Nope, don't need to take it. Stop it. I had withdrawals. For the first time, I never knew what a withdrawal felt like of like pain medication. I was sweating. I was erratic emotionally. Like, I mean, it was like my body felt like it needed the pain meds because you go into complete shock. You're in pain. And it was scary, very scary. And it was an eye opener to see how quickly people can get addicted to these things. And it's a serious thing. And scary. Because it's not like you needed it. I mean, you're in so much pain. What else are you going to do?
Yeah, I was going to say, how long did it take you to break that then? Did you jump back on or no? You stayed off?
No, I was miserable that night. Miserable. Like, I hate to say it, but I felt like I was like a drug addict almost.
Yeah.
Like, literally. And it was very weird. It was a very weird feeling coming from the girl that doesn't take any meds. And that's maybe part of the reason why. I don't know.
Won't even take Tylenol. Yeah, I feel that.
Yeah.
I feel that.
Yeah. So, that was probably the worst night. And insomnia, like, you have no idea. I looked like a crazy person. And then I started taking just Tylenol.
And that helped.
And that helped. Yep.
Good.
And then eventually you're in the clear and you feel. Once you start feeling better, I swear you're like, I could get through anything.
Yeah,
I could get through anything.
This was the hardest thing in life,
Yeah.
and
Yeah.
everything else is a piece of cake.
Yeah.
All of a sudden,
Childbirth?
Yeah.
I'm ready. I'm ready. I don't need an epidural.
I don't need
just let
shit.
me. I'm just gonna push and we'll be good.
just like the kids are just slide right out. Hey. All right, next.
Another really weird thing is taking a shower right after this because it was my poor mom. Man, she saw a lot.
Trooper.
Yeah, and I cut my hair for the surgery, which was a big decision because I had very long hair.
Yeah.
But I said, there's no way in hell that someone's going to wash my hair for me with all this hair and comb it out and everything else. It's just going to be matted.
And you couldn't lift your arms.
I could not lift my arms.
Yeah, so that was even.
Yeah.
I'm sure that makes you feel like you should never take for granted the little things like that.
Yes.
That's like me when I get vertigo.
Yes.
Just walking and not getting dizzy.
Mm-hmm. I have 4 patients right now suffering with vertigo.
Yeah.
And, I mean, they're doing great with treatment, but it's like they suffer.
It's very scary.
Yeah.
It's very scary.
Yeah.
People that have never had it before don't understand how scary it actually is.
Yeah, because it sounds like, oh, you have vertigo. It's not that big of a deal.
Yeah,
like you're a
it's
little
nothing.
dizzy.
No, it's not. It's and then once you get it once, it's always
With
in the
you.
back of your mind.
Yep.
Always. Twice already during this podcast, I've sat there and I thought, "You're good, right? Yep, you're good."
Oh, God.
Not feeling anything.
Yeah.
You still just almost check yourself.
Yeah.
Every day, walking around, getting up first thing in the morning. How do we feel? We're good. Let's get out of bed.
Well, because you almost have like PTSD from it.
Yeah.
And you get nervous. And
Yeah,
you
no, I
probably-
gotta go to a psychiatrist for it,
Yeah.
or a psychologist. I have to go
Really?
and like talk to somebody and
Good.
get it because just to get that portion out of
Yeah.
it. Because ever since I had that first one, it was traumatic and
That's another thing, talking about like mental health, in all honesty. I didn't cry about anything. I was like in my head, I thought I was just very strong. And I was like, just keep pushing forward. You're good. You're good. The only time I had a real mental breakdown was when I was having like withdrawal from the meds. But I realize now it's hitting me more. And you need to let things out.
you have to talk to people.
Yes.
Whether it's family,
Yes.
whether it's friends,
Yeah.
something. You have to have that support circle to just take that burden
Yeah.
away. Because otherwise, if you're just holding it in and locking
Yeah.
it in, it's gonna make you feel 20 times worse.
Yeah. And it's everyone needs a support system. That's why I really I know everyone says, "Oh, I'm here for you." But I truly want to be there for women who anyone who needs an extra support person in their corner, because if you have someone that has gone through something very similar, it's much easier to cope. It really is. And my surgeons are both men. They're amazing. They are gifted, they're talented, but they couldn't give me real advice or
the reassurance of a woman can.
Yeah, exactly.
Because they haven't gone through it.
And now I'm actually in the works of I work with Pink Aid, which is an organization. They actually help women who are struggling financially through treatments since they've been diagnosed or whatever it may be. They are amazing. They help so many women. And they had a big fashion show a couple weeks ago. What an amazing experience. They asked me to walk the runway with other survivors and everything else.
Did you strut?
I did strut, but
Yes.
I was so nervous about even saying yes, because I was like, I didn't have breast cancer. Like, who am I to be able to walk down that runway when these other women they just finished their chemo treatment or whatever it is. And this one woman who was, she just finished her chemo, and she looked at me and she was like, "You still went through it." She goes, "First of all, this will start at 20 years old for you." And I was like, sometimes you don't realize everyone's journey is just different. And I don't see my journey as bad as other women. But then there's other women who never even had any breast issues in their lives. So everyone deals with their own stuff. But it was the most amazing experience I could have ever. It was amazing.
That's great.
Yeah, and I got to walk with my mom.
Oh, that's awesome. That's
so
amazing.
she felt like it was, she did a lot. She did
Yeah.
and I think
that's the support circle right there.
She probably has. I know it kills her, because usually the parents are the ones who are going through the surgeries or an illness or whatever it is. So for her, the gene didn't come from her side of the family. So thank God, you know what I mean?
Yeah.
But
really, your dad carried it?
Yeah, my dad.
Wow.
It's all on my dad's side.
I wouldn't even. I mean, it's not that. Of course,
Yeah.
it can happen to anybody because his mom and this stuff like that.
Yeah.
But
Crazy, right?
that is wild.
That's
and how do they know that? Did he have to get tested to isolate where it came from?
My dad is like old school Italian. He doesn't even go to any doctors.
Okay.
I'm lucky if he walks through my doors, and he only comes to me once.
I met him. I remember I met him.
Yeah.
He came in.
The only time he comes is if he literally can't move. And then he's like, "Okay, I'm fixed enough. That's it." Okay. This man, came here with not a penny in his pocket, right? Very hard worker. Love him to death. Probably where both my parents are hard workers. That's where I think most of my work ethic comes from. But my dad is now very successful. Like, when I was growing up, we did not have the money that, he has now.
Yes, yeah.
He worked his ass off, you know what I mean? And
Paid the dues.
I was always the kid that was shopping at Old Navy when everyone else was at designer stores when I was in elementary, middle school, because I grew up in Dix Hills. And I always was like, "Oh my God, we don't have what they have." And and you're like, "Oh my God, you are very, very fortunate." You know what I mean?
Yeah.
With where we were. But anyway, he is very successful now. More than he even knows what to do with, right? He wouldn't spend a little extra money to get electric windows in his pickup truck. He was like, "I'll do the roll down." And I'm like, "Dad, you have a frozen shoulder. What are you going to do?" So I'll walk over to his car and I'm like, "Can you roll down the window?" I'm like, "Oh my God, we're just going to have to yell at each other through the window." This is the man. So no, he has not gotten tested yet, but all the cancer is on my dad's side.
Okay.
Yeah, all the breast cancer and pancreatic cancer. That's another thing.
I was about to say, really important to just get for everybody to get tested, then, just to make sure that you don't have these precursors, especially if you're gonna have kids, because you're gonna pass that down to them.
Well, not necessarily. Doesn't mean that you're always gonna pass it down.
Oh, it's like a 50-50?
It's just
It's just random.
Yeah.
It could be 95-5.
Yeah.
It could be 100.
Right. Yep.
So just now, when you have a baby, would you be able to just test the baby when they're little, or
You know what,
do you
actually?
have to wait to have them develop?
I'm not sure.
'Cause
That's something I actually want to find out. Yeah.
That'd be interesting to find out if you could just test the baby right when he or she is born to see if the gene passed down.
Yeah.
Because then you at least have that knowledge going forward.
Yeah.
Because that's huge as a parent.
Yeah.
Because like you said, your mom was in the trench. Your mom's in the trenches with you.
Right.
And if it wasn't for her, there's a lot that you wouldn't have been able to do.
And I mean, there's so many girls who got a double mastectomy because their mom had breast cancer. Do you know what I mean? Like, and they don't have a gene mutation. Majority of women who have breast cancer do not have a gene mutation. That's why, like I say over and over again, I feel very fortunate because I had something showing me that I needed to get something. I needed to fix this. Most women don't have that opportunity.
They don't have that indicator, like that little.
They just get hit with that cancer word, and
that's probably like getting hit by a brick truck.
I can't. Yeah.
Just stop you in your tracks.
I can't. I will never forget the feeling when they sat me down the first time when I was 20.
The radiologist.
Yeah, and I thought I had breast cancer, and then you have to wait for the biopsy results every time, and it takes a little over a week.
I can't take the blood test. I can't take waiting on the blood test. She goes, yeah, well, if I call you, there's something wrong. So I'm sitting there 2 days after, and my Langone, my NYU Langone app keeps updating. New test result available in the app. So I'm sitting there, I'm going like this.
Yes.
Well, do I have cancer? Am I dying? I'm like, what's going on, man? And then I didn't know what I was reading, so I sent it to my coach down in Florida. I go, what's going on? He goes, bro, how much carbs are you eating? You fat dude. That's what he said to me. He goes, stop eating carbs. He goes, everything else is fine.
Oh my God, you could drive yourself crazy.
Oh, yeah.
100%.
Hypochondriac. You just start thinking about all. It's like, oh, my God, that's it. We're done. Even when I had the neurological shit over the summer.
Yeah.
The random neuro stuff. I'm sitting there. I'm in bed. And all of July went by. I didn't get to get out of my house. Like, nobody realizes that. People weren't seeing me at Bev's. I was laying in bed all of July, basically.
Wow.
And I didn't have vertigo. I just was feeling off. Couldn't explain it. Every time I'd take a step, it felt jarring. Like almost like every sense in your body is like shocking you kind of thing. And I couldn't explain it. I wouldn't want to my mom had to walk Kenji. I couldn't walk Kenji.
Wow.
I did not want to leave the house.
I didn't even know this was going on.
Yeah, like
I'm sorry.
It's okay.
Yeah.
No, it was a lot. It was a lot to deal with. And whenever I feel like that, of course my first thought is I have MS. That's it. I have MS like my dad. And every single doctor I talk to, they go, "You don't exhibit any of the real symptoms of MS. You're fine."
Okay.
And everyone tells me just go get the brain MRI done because then that tells you.
Have you gotten that?
I haven't. No.
Okay.
I've been a little biatch.
Well, but same thing. Perfect example.
Yeah.
Sometimes you would rather not know.
Yeah. Now I had an MRI when I was 19. They did a full body because I was in a car accident.
Okay.
So there was nothing.
Wow.
So chances are it's still
nothing.
the same.
Yeah.
I don't think I have it. And everybody, like I said, that I talk to, I don't exhibit any of the symptoms of it. But anytime my foot feels off or goes asleep, you go.
Your brain automatically goes there.
That's it. Here we go.
Yep.
Because I think of my dad. My dad progressively has gotten worse over the years. He's, he is in a wheelchair full time now. He's got AIDS at his house. He lives in Freeport. So it's a tough thing to sit there and think that my existence of what I do now will end up like that.
Yeah.
But the other side of it is, God forbid, everything ever happened, there are a million people that have MS that live healthy, normal lives that you wouldn't even know. My dad just didn't take care of himself.
Well,
he abused himself.
I can tell you right now, I have a young woman has MS, and I've been treating her since I opened my practice, and she's been good. And her doctors are shocked because it seemed like it was progressing, and it kind of went like to a complete halt. And the only thing that changed was treatment. I treat her 3 times a week, and I keep her moving. And
you have to. That's the activity is the hugest. Is the hugest. I almost said what great English is the largest portion of it too.
Yeah.
My dad kind of just threw his hands up. And
it's even speaking of like neurological, something else. I've been treating a lot of women now after speaking about double mastectomies and breast cancer. A lot of women have been coming in now who have either had a double mastectomy or they're fighting breast cancer right now. And I have a lot of women who have post-mastectomy syndrome, which is a pain syndrome. It's basically your nerve endings are trying to reattach and they're misfiring. So all you're feeling is just pain.
Really?
Yeah, across your chest. You could feel it's miserable. And this can happen months later. It doesn't have to happen right away. So you might think you're doing great after your double mastectomy and all of a sudden your nerves are trying to reattach. Like, I'll be honest with you, if I go to itch my skin right now, like I'll feel an itch. Most of the time it's actually not an itch. It's my nerves trying to reattach. It signals my brain like it's an itch. I go to itch and it's pain. when I try to go itch myself. It's like almost like you can't itch the itch, if that makes sense.
What does the pain feel like? Is it like a stabbing, sharp?
Sharp, like an electric sharp.
A jolt.
Like, yeah. And then it'll be stabbing, like constant. And I'll be like laying down some nights and I'm just like, I think I'm like, you feel like you're crazy because you're just laying there and you're like, oh, here it is again. And it literally just feels like someone's like stabbing you with like a really sharp pencil, like over and over and over again. And then it'll go away.
It's the weirdest thing.
And then like sometimes I'm in the shower and the way the water is hitting my chest, sharp pains, like triggering. It's just crazy.
So now what do you do to treat something like that? Is there anything you can do?
So I can't treat myself with that because I'd probably hurt myself if I was doing it on my own. But I treat a lot of patients with it and I do the stim on the needles and it's actually basically signaling the brain. So basically if you were watching a live MRI of the brain, right? When you're inserting these acupuncture needles and then especially when you're stimulating it with the stim, you would see areas of your brain light up depending on where you're placing the needles, everything else. And you would actually see, again, I'm kind of going all over the place, but you would actually see your happy chemicals, your serotonin levels, your endorphins, your dopamine, everything like that increase. So you almost get like a natural high and your nervous system finally gets to relax and it's not on overdrive. So your body gets to start healing itself naturally without all that inflammation, which is amazing. And that's why a lot of people, when they get off the table, you'll actually hear them say, like, I almost feel like I'm like high. Like I feel like relaxed. And it's literally what your brain is signaling to the rest of your body. Pretty crazy.
That's wild.
Yeah.
That's wild stuff.
And they've done so many studies and that's something I guess I wish it was spoken about more because like Sloan Kettering, amazing. They do so many studies. They're big on integrative medicine. Very big.
Really? I wouldn't expect that.
Yeah. They treat almost every single patient of theirs. They offer it to every single patient who's going through chemo or fighting cancer. Acupuncture, massage, all these different things. Because they do their own studies in-house. It's amazing. And they get amazing results. And everyone says trust the science. It's part of the science.
Yes, you have to understand that there's more than just one doctor saying one thing.
Yes.
There's 1,000,001 different ways to go about it, and like you said earlier, not every person is the same.
Right.
And you can't treat everybody the same.
Right.
Because it doesn't work like that.
Right. And when you have scar tissue, there's lack of blood circulation. It gets stagnant. It's very thick, dense, right? It's there for a reason. It's protecting your body. It transformed and everything because of an injury or a surgery, whatever it is. But when you're needling that area, it's a foreign object in your body, right? And your blood cells start circulating towards that area. So it loosens up the scar tissue. It increases your blood supply. It's amazing, and it decreases inflammation. And this is science. And I wish that it was, like I said, other countries, it's very spoken about and everything else. Like I was in Italy and I did part of my clinicals there, and it was amazing. I was in the stroke unit and they did acupuncture on every single patient in the stroke unit, and it was all for neurological issues.
And what did they find that helped with?
For the stroke patients who had like paralysis, it would help with literally their nerves. So so
getting motion back in,
like Bell's palsy, for example, their success rate of treating Bell's palsy was like through the roof. And it was acupuncture. Have
you seen Thor? You know the actor, Thor?
Yeah.
I was with him at the rain shoot a couple of weeks ago in LA.
Oh, wow.
Yeah, I was shooting out there and it was pretty cool.
Oh, that's amazing.
Yeah, I was there for like 4 or 5 days. But he has Bell's palsy on one of the side of his face. He's had it for a while.
Oh, I wish he was here.
Yeah.
Yeah,
he's had it for a while. I can't imagine he hasn't tried acupuncture.
Some people are not open to it.
I think he got it when he lifted. He lifted a certain. Ooh. I guess it was something like I can't speak on it.
Yeah.
He got it something like 1,000-pound lift or something like that, and I guess it froze half his face.
Yeah.
My mom actually had Bell's palsy when she was younger, so she understands that pretty well, and how scary that is.
Yeah. Well, your face literally can't move.
Freezes.
Half your face. Yeah. It's such a weird.
Yeah, that's strange.
Like you would never think that. You wake up one day and all of a sudden you're like, what just happened?
Yeah, he's got the froze. It's crazy to look at. Half the face doesn't do it, and then the other half, and you would think that it all kind of works in conjunction.
Yeah.
That the whole face wouldn't be able to do it, but it only one side freezes.
Yeah.
But yeah, that's crazy. I want to ask you if there's something that you can leave the listeners with an overall message.
Trust yourself. Always know that there are people out there that want to help you, and you need to find those people. And I know this sounds kind of stupid, but anybody, and I mean anybody, DM me, text me. If someone can give my phone number out, it could be anybody. Doesn't mean that I have to treat you as a patient if you just need a friend or you just have questions for a loved one, yourself, anybody. It doesn't even have to be breast cancer. It could be any sort of cancer. It could just be anything. There's a reason why there's certain people that are very vocal about these things, and it's to help. I mean, at least you would hope that they're being vocal to help. Let me help you in any way that I can. It might be the smallest thing of just saying, yeah, after your surgery, do this. And there was one woman that I found out that the surgical bras are so tight and they're painful, right? They're itchy, everything else.
I'm sure.
I figured out that I got a really soft t-shirt, right? I cut it down the center, put it on, and I put the bra right over it. Something so stupid and simple, right? No one ever told you this, though. It was like you have to play like arts and crafts. And it helped me so much.
All of a sudden, you're a t-shirt manufacturer.
Yeah.
Just figuring things out.
Seriously. I sent my mom, I was like, get as many soft t-shirts as you can, and we're just going to keep cutting them. And I tell it to every woman now that's getting a double mastectomy. Life-changing. Something so simple.
Little tips.
Yeah. Yeah.
Just only people that have gone through the trenches would understand and know.
Yeah. And trust your instinct. If you don't feel comfortable with your doctor, if you don't feel comfortable with your decision, getting a double mastectomy is not for everybody. If you really are against it, don't feel pressured into doing it. You have to do it at your time. Speak to people. Feel good about it. But don't ever feel like a double mastectomy will change you for the worse. Because at the end of the day, your scars tell a story. And you will always be able to look in the mirror and look at yourself and say, I overcame that. I'm a lot stronger than that. And that's why scars are beautiful. It's part of your story. And that's my final thing.
I love that.
Yeah.
So how can people get in contact with you? What are your Instagram? Just plug your business as well, please. Say.
Yeah. So my business name is MoveMedRx. It's integrative medicine and wellness. And you can look me up on Instagram, Marina Bina, or MoveMedRx.
And where's your
I'm in Huntington.
location?
7 Loma Place, Huntington.
Beautiful building.
Yes. And anybody can reach me on my cell. I mean, I don't know. Should I give myself?
Nah, you good. No. Don't give someone out. Don't give someone out. You might start getting other questions instead of just about breast cancer.
Right.
Might
So
start getting other type of inquisitions. None of that. So listen, I love you. You're amazing.
I love
Thank
you
you.
too.
Thank you so much for coming on. You're
Look at
awesome.
those arms.
It does it right. Not too bad.
Right there. Yeah.
I hit arms before I got here. I
Yeah.
knew I had to get a little pump going on.
Oh, Kenji's looking at you.
Yeah, she's.
That's my dad.
He's like, hey man.
Yeah.
Yeah, you're a warrior. I mean,
Thank you.
there's no other way around it. You've done a lot, and I think you're gonna continue doing a lot for women, especially.
Also, last thing.
Please.
I'm in the works of coming up. I have my next surgery coming up, which is more reconstruction and fixing a few things that didn't work out so well after the double mastectomy. Much simpler.
Probably easier when
surgery.
everything's healed and you can see things. And
it's going to be a short surgery in and out, but it'll be like a week or two recovery. But after that, I'm actually setting up I'm figuring out the details, but eventually I will have, whether it's 2 Sundays a month or 1 Sunday a month, where I will be treating women who do not have health insurance for free, who are struggling with breast cancer. Whether they're going through chemo, radiation, or they're post-op, there's something that I can treat you for regardless, because there's pain through all of it. Especially when you're going through chemo. That's another thing people don't realize. Acupuncture and integrative medicine, there's so many things that it can help you with.
so many applications for helping.
Yes. And, or post-op care. I'm here for you. So I will, eventually it'll be posted and everything else, but it will be 1 or 2 Sundays a month, and it will be free.
That's amazing.
Yeah.
You're amazing.
Thank you. I'm trying. I just want to help. Sometimes I realize I'm only one person, but one day I'm going to clone.
You're putting the hat on. You're putting all the hats on.
I'm going to be on Shark Tank and figure out how to clone myself.
Let's do it.
Yeah.
Let's do
Will
it.
you
We'll
help
figure
me?
it out. I'll do the
Perfect.
video pitch for you. We'll be great.
Perfect.
We'll get you on the show instantly.
Awesome. Shark Tank, I'm coming for you.
There you go. You're already here. I want to thank everybody for listening to episode 8 of Rizology.
Oh, that's one of my lucky numbers.
Yes.
Sorry.
So there you
That's
go.
great.
Look at that.
Yeah.
With the lovely Marina.
Thank you.
And listen, if you, there's no plugs from me. Like everybody
Yeah.
knows where they find me. Everybody knows what they do. But if you hear something that you think could save someone's life, or you hear something in this episode that you think can help a
Yes.
family member,
Yes.
a loved one, anything like that, share it.
Yes.
Just share the episode with them. There was a lot of information in here. There's a lot of really valuable things that somebody may not know, and
Yes.
this could save their life.
And my heart goes out to anyone battling any sort of cancer. You know, I've seen, we spoke everything about, you know, breast cancer, but my Nona was my best friend. She passed away from pancreatic cancer. I was her main caregiver. That scarred me because you see someone truly suffering. Pancreatic cancer is something it's just a whole nother ball game. And so anybody that's struggling with any health issues or mental, anything, my heart goes out to you. And there's someone out there that can help you, just to help you get along the process a little bit better. And I'm praying for you. That's it.
So that's it. I mean, that's perfect,
Yeah.
literally. But
Yeah.
I appreciate everybody. Thank you. Peace.